Sánchez is recognized.
Thank you, Mr. Chairman, and Madam Secretary. Thank you so much for taking the time to appear before the committee today to discuss the administration's fiscal year 2014 budget. Budgets, simply put, are just a reflection of our priorities, and our priorities should be very clear: protecting our seniors in their golden years, giving our children quality education so that they can achieve their dreams, and properly funding health care to keep our families in good health. And I was pleased to see that the President's budget does address many of those shared priorities. In particular, I was happy to see that the President's budget adds $1.5 billion in new funding to implement the federally facilitated and state partnership exchanges that will help provide health care insurance for over 25 million people, that the President's budget invests $1.4 billion in new early Head Start child care partnerships. That's an issue that's incredibly important for Southern California. That it increases funding for the Food and Drug Administration by $280 million to improve food and drug import safety, that it continues to invest in the National Institutes of Health, and that it increases funding for vital Title X family planning programs by $30 million over last year's request. All of those, I think, are important priorities that I think every American family can benefit from. And as a working mom, I have a particular soft spot in my heart that the President's budget would improve both the availability and the quality of child care. I hear far too often from parents that the lack of affordable and quality child care is a significant barrier for them to work. But what I want to really focus in on is something that's been touched on by my colleague Mr. Kind and others in passing, and that is the savings that the Affordable Care Act produces. Because something that I find somewhat paradoxical, if you will, is that the Republican budget that we saw included all of the ACA's Medicare savings and taxes in that budget. So on the one hand, I hear from my Republican colleagues, they claim that the ACA destroyed Medicare and levied a heavy tax burden across health care, but on the other hand, they passed a Republican budget that retained the ACA's savings. So, Madam Secretary, I'd be interested in hearing about some of the savings that the ACA has produced and your comments on the paradox that on the one hand, folks seem intent on repealing ACA, but on the other hand, they want to retain the savings from ACA.
Well, I think the President believes very strongly, as we do in the Department of Health and Human Services, that keeping our commitment to the seniors of this country that was made in 1965 when my father officed in this building and sat on the Energy and Commerce Committee and helped to write the Medicare law and just turned 92, and he's pretty happy that he did.
I'm sure you are, too.
I am. That we are very concerned that, on one hand, Medicare beneficiaries continue to receive that commitment and that promise, and that we find strategies that continue to look at deficit reduction and long-term growth in the plan. And I think that's what's captured in the President's budget. It was part of the Affordable Care Act, $800 billion worth of savings, and we are very much on track to fully implement that with additional benefits. People said you can't do it. It can't be done. You can't deliver good care and cut costs. Well, I think we are on our way, and we're in year 3 of doing exactly that. We see that same strategy into the future, where you can actually figure out care strategies that work to benefit a growing number of seniors. We have 11,000 people a day turning 65 in this country, each and every day. So we have the largest number of Medicare beneficiaries ever involved in the program, and yet we are on a historic low in spending, 0.4% in 2012. Never been seen before, and as Congressman Kind said, the CBO has reconfigured their projections into future years. So I think the President's budget captures the notion that there are very effective strategies that deliver appropriate care, make sure that we take seniors' needs into account. We continue to update quality programs, at the same time constrain the costs into the future.
All right, thank
you. For
you.
your comments.
Mr. Ryan is recognized.
Thank you. I guess I should pick up where Mrs. Sanchez